Hello, everyone. Welcome back to Real Conversations about Aging Parents. This is your host, Rebecca Tapia. Thank you so much for joining me today. I do apologize. It did not get a podcast out last week. And honestly, that's probably going to happen intermittently through the holidays. Things get really, really busy. And I have like 5 or 6 things that I was going to publish and I just don't like them. But I promise I do plan to continue putting the podcast out. Hopefully things will stabilize again after the first of the year. But anyway, today I wanted to take time to discuss cognitive changes that you may notice when you're interacting with somebody over the holidays, and how do we decide if they're concerning or not concerning? Now, as a disclaimer, of course, if there are concerns, you can always go speak to a physician or get that person encouraged to go see their physician and get more care and evaluation. So I'm just going to speak today broad generalities of how you can think about these things. But to speak about kind of cognition in general, the idea is that your quote unquote cognitive peak is somewhere in your early 50s. And so that's when you start to notice an age-related decline through the rest of your natural life. So that's either really good news or bad news, depending on which side of early 50s you are and listening to this podcast. But the idea is we have our physical peak in our 20s, maybe even late teens, and then our cognitive peak is a bit later. That obviously doesn't apply for everyone. And there's lots of factors that may change where that peak is, make it a little bit sooner for issues with things like heart disease, diabetes, smokers, etc. And then maybe push it out a little bit later for people that are very, very active cognitively and physically, that they might be able to extend that. But either way, just again, speaking in broad terms, after our 50s, there's an incremental, usually non-rapid, age-related decline that happens over time. Some people call it like senioritis or whatever, names you want to use for it. But because you might be coming in contact with aging parents or aunts, uncles, whatever, and notice changes, especially if you're only seeing them once a year, say you're just able to visit on Thanksgiving or whatever's going on. I wanted to make sure I put this out there just to give you a foundation of some things to think about of what would be kind of more on the normal side and would be more on the concerning side. Now, these are not black and white. I'm going to talk about it more like a spectrum, like some things I'd be like, oh, not so concerned about. And then maybe some things in the middle, and then things that are more concerning and how you might be able to pick up on that. Full disclosure, I am working on getting a cognitive specialist to come on and talk a little bit deeper on this issue. But because I know you might be going out for the holidays and seeing a lot of people that you don't normally see that often in the next month or two, I wanted to make sure that we got this information out there. So what would be normal? So let's talk about some things on the normal side of aging. So these can happen at any point in life, but the idea is that these things may happen more frequently over time as we age. And one of them is a slower processing speed. And so when information is presented, that information doesn't get processed as quickly. And it may take longer to read something, reread something, may take longer to ask some clarifying questions. And think of it just kind of like a slower connection, like a slower internet connection. Like that processing speed may be delayed just enough that may make it difficult to have kind of rapid decision-making or conversations that are multi-layered and going through a lot of different topics. So there could be just taking longer to take in new information. And one of the ways around this is to just make sure that you budget enough time, especially if there's a difficult topic, to allow for some extra processing time or some clarifying questions. Another thing that I would kind of put more on the normal end of the spectrum here is difficulty with multitasking. And so if somebody was previously able to cook dinner for everyone and do the dishes and set the table, maybe this year they're just cooking dinner, the last thing you'd want to say is, well, every year you do all 3 things and now you're just doing one, which that's terrible, by the way. If somebody is cooking, somebody else should always be, I think, assisting with the dishes and the setting of the table and all that stuff. But anyway, that's just a human thing. But the idea is that you look at the most challenging situations for the brain, and that's where you start to see some of the rust or some of the breakdowns happening. And you can see that in this like complex sequencing, especially for hosting an event or when there's multitasking happening. That's when you're going to see it more than if you're just sitting across from somebody drinking coffee or something. And obviously the holidays, if you're going to visit an aging parent and they're hosting this event or this gathering or whatever, right, they're going to be in a more challenging cognitive situation than they may just be in their everyday life. So you can kind of keep that in mind. Or say they're even coming over to your house, but the challenges that they have to get there, whether it's flying or packing or whatever else is going on may also be part of this, right? There may be a lot of multitasking going on just to help participate in the holidays as well. And so when you're trying to multitask, some of the ways this breaks down is you kind of lose your train of thought more quickly. You can make more mistakes, and you kind of have to, stack your nickels in one of the three things that you really want to have done and get accomplished. So if in the past when you were 20 and had nothing else going on, you could do all three of these tasks at once. As we get older, we might have to trim that back down to two, or really, if there's really one important task and two less important tasks, really invest in making sure that that one goes well instead of trying to divide our attention. Because really, in most of the brain science that's out there, you don't really multitask. You're just really good at splicing your attention very quickly between multiple things and kind of setting one thing on the back burner and knowing, okay, I'm going to have to return my attention to this. But for all intents and purposes, at one point in time, I mean, in a very, very split microsecond, you really can't only have your attention focused solely on one thing. And so multitasking is really sort of a mirage of you set shifting between multiple things at once in a sequence that makes it appear that you are somehow simultaneously doing all three things. You're just sort of like switching from one thing to the other very quickly and seamlessly and sort of handling it that way. But the idea that your brain is running three simultaneous processes at the same time is maybe not as accurate as one, but switching very quickly. So anyway, so you can kind of imagine if we already have that slower processing speed in the background, that multitasking starts to break down. And that's where it becomes important, really just to focus down, right? And plan things out and make sure there's plenty of resources to accomplish, whatever goal is there versus, throwing it up against the wall and hoping that all these things get done. And so multitasking situations, if you're thinking, wow, my mom used to be able to do this, now she's only able to do that. Well, there's a lot of context there in this. And you have to kind of think about the tasks and then how much energy is expended for each one. Another thing that's very common and can increase with aging is mild word finding problems. So things that are kind of just on the tip of your tongue. So I'm trying to remember somebody's name or a place that we went or a year that something happened or an ingredient for something or whatever it is. It's like it kind of gets stuck right behind your nose. It can't get out of your mouth, right? It's in your brain. It's there, but doesn't quite make it out of your mouth. And so that happens often, and it can happen when we're more tired or fatigued or stressed out anyway. But that kind of mild word finding, I always tell my patients, it's like a bunch of like train cars are coming out when you're speaking and you're forming the train in your brain about a second before it comes out of your mouth, but then you miss a car. And sometimes you just let it go and you just say the wrong word, or sometimes you stop the whole train and you say, okay, I got to find the right word, insert it here, and then kind of keep the train going. So those word finding problems, again, I kind of put more towards the normal end of that spectrum. Another one is having a little bit more difficulty with new information, new technology, new processes, not downloading or adapting quite as quickly. And part of that is just the brain is very focused on maintaining important old information and trying to decide what new information is important to focus any resources or attention on. And so your brain has to kind of have the buy-in that new process or new information is important, and then go through a secondary process to actually download it and keep it over time. So might need a little bit more repetition at first, and more explanation as to why this information is important, or more instruction on the beginning. Also, another thing I kind of put more towards the make sense category, which is slightly more distractible, maybe losing your train of thought more often, or more easily fatigued or early fatigue. And so if, say, you have like a Thanksgiving event that starts at noon, and that person used to be able to talk into the evening until 10 o'clock at night when everybody left, that's a long day. But now maybe they're retiring to their room about 6 or 7 p.m. Oh my God, I just said 6 or 7. My kids are going to really, really think that's funny. And I did not do that on purpose. But anyway, so the idea would be that, the stretch that you can have to stay in the game and these celebrations or in, family interactions may be less, and that fatigue may be evident sooner and sooner. And so all in all, kind of when we're talking about this normal side of the spectrum, the way I like to think about it is think of yourself after a really bad night of sleep or a really stressful period of time, and that next day you're a little bit slower, you're not handling your multitasking quite as well, your words aren't coming out that quickly. That is kind of within that range, and that may just happen kind of more and more over time. But that's kind of the character of things that I would still call normal. So if I'm coming away from a holiday celebration, I'm like, man, so and so couldn't remember that word like 3 times. Like, that's probably okay. That's probably what we're going to put into on the normal side of the spectrum. So let's talk about things that usually don't change, right? Even in early dementias, you'll see these things tend to kind of stick. And this information is actually used in testing to understand kind of what's deep in the brain, like what is the normal state of the brain that doesn't tend to change over time, even under the influence of things like sleep or stress or aging. And one of those is just vocabulary. Like, it's like whatever somebody's vocabulary level is. For my mom, it's really high. She's like a Scrabble champion, right? That vocabulary tends to stick. That's the way that you speak. And it's really hard to make the brain forget just how it speaks, right? As long as it's still able to communicate verbally, there isn't really a process that's going to say, well, you used to use, you know, 12th grade vocabulary. Now you're going to use 4th grade vocabulary. So vocabulary is actually a really important element that tends to stay preserved in most situations, that somebody will still use, the proper term for this verb or whatever when they use it. Like, that is something that doesn't tend to deteriorate over time and will largely stay intact. And then also just like general understanding. So like big picture understanding of situations or nuance or just their, how they approach problem solving and their judgment. Like, that tends to stay relatively intact over time. And so think of these as more like core functions of the brain. So word finding is not a core function of the brain. The brain can still communicate forgetting a word every now and again. It's not that big of a deal. But the way you communicate, your vocabulary, your general fund of knowledge is sort of the core foundational part of the brain. And so let's talk a little bit more about things that would be like a little more on the concerning side that I would think twice about, or maybe dial in a little bit more if I started to be concerned about this. So one would be changes in everyday function. So like if you're walking into someone's home and you see a whole pile of like past due bills that happens to be right at the entrance of the door, and they have a little table there, and you're like, hey, wow, I've been coming to Thanksgiving for 7 years now, and I've never seen a pile of past due bills next to the door. I'm not saying you have to grab those bills or open them, but just the idea of observation of, hey, that's like a change, right? That isn't something that person would normally do. Now, if that was the way they ran their whole life, maybe that's still the same. But the idea is like, is that going to be problematic for them? Or maybe another thing I'd say that's on this end of the spectrum, which is less normal and maybe more concerning, would be getting lost on familiar routes. Like somebody's like, oh, I'm going to go to the corner store and get some ice. And they get lost on the way to get the ice. Or they take a long time to get back. Or they can't really tell you, where they were or why it took so long. And so just noticing, all right, this person said they were going to go out and run this errand, and it took 3 times as long. And to be honest, a lot of times that person might just pop back up and hope nobody noticed, or not even realize themselves that it took them 3 times longer than normal. And that would be a practical thing that you may notice that would be more on the concerning side and may, in the right context, warrant some more questions like, hey, where did you go? What did you do next? And see if they have recent memory of what actually happened in that intervening hour or whatever it took. Another thing on the more concerning end of things would be a change in like judgment. And that can be judgment of like, hey, they said they were going to make a Thanksgiving dinner for 20 people, but it appears they bought food for maybe that could serve 5 people. Like the judgment, the connection between the intention and then the execution of it are very, very different things. I'm not saying like they were going to host 20 people and they made food for 18 people. I'm thinking of like more broader issues of like, wow, this is a really big miscalculation. And I keep using Thanksgiving examples because it's the week of Thanksgiving. But anyway, so uncharacteristic judgment issues, impulsive spending. Like there's a lot of new things that are in the house, and that's not normal. Like You don't normally walk in and there's, 5 new pieces of furniture or hoarding or a lot of new items that would be unnecessary. And again, I'm not saying to like be judgmental and be like, you don't need those extra pens that you bought. I just mean like unusual. And a lot of this is not so much like, is it happening or not? Is it unusual for that person? And do you have enough context with that person or know somebody who has enough history or context with this person to know that this is abnormal or uncharacteristic of them? Another one is just to be on the lookout for any mention of a scam. Like somebody says they have a new strange investment, a new credit card, or suddenly they seem to have like a large stack of gift cards in the dining room for no reason or something like that. So these kind of like very telltale signs of potential scams and being aware of kind of how they think about them, how they're processing that, and do they seem aware that scams are common, increasingly common, and that they are in the target population or target demographic to be scammed. And again, that can be a very sensitive topic. I'm going to do a podcast in the future just about elderly scams. But the idea here is that you can pick up on some context clues when you're with somebody, and you may be the only one that can develop a level of concern if they're kind of really into the scam and really can't notice that that's actually what's happening. Now, I know I mentioned that the vocabulary kind of stays the same, but one of the more concerning changes can be very difficult is maintenance of even simple conversations. So if you kind of think of a conversation as a volley back and forth, you're talking and someone else is talking, and it's kind of a journey, right? You may occasionally switch topics or come back or circle back. But the following of a conversation, which is different than somebody's vocabulary, so the actual ability to follow a conversation is a concerning development. And what will happen is you'll see that the topics of conversation become increasingly limited over time. So this would be a more concerning development. Or when you're trying to engage with somebody on a simple conversation, that they have difficulty staying in that conversation, or they find a way to exit the conversation, or they'll keep changing the topic back towards like their safe zone of what they know that they can communicate and talk about. And so that could be having forgetfulness within the same conversation. Now, everybody forgets details at times, but this idea is like we're having this volley back and forth on this conversation, and we just talked about this, and then we're maybe 30 seconds removed, and that person has no recollection of having just discussed this topic. Now, if it's a small detail, oh, I forgot the date or the time that you mentioned, but you're like, oh, I didn't realize we just discussed that so-and-so broke their leg, and we're only 30 seconds removed from that. That could be concerning, especially if it comes up repeatedly. And the way I like to think about it, if there's one thing that happens, you kind of like one get out of jail free card, but more important than that even is the frequency at which it's happening, especially if it is a repeated issue. So it might be something like, oh, that was really strange that happened. And if you have a second conversation the next day, maybe worth trying to kind of test that again and see if that recurs. Because a lot of what we look for clinically is not just the presence of something, but how recurrent it is. So if somebody comes in and says, oh my gosh, I had this conversation with my mom 6 months ago over brunch and it was terrible. She couldn't track anything, but every other conversation since then has been normal. That's a completely different scenario than that has happened every single time I've talked to her in the last 6 months. And I know that sounds obvious, but the idea is that we look for these trends and that they're repeated over time. And that helps us not be so focused in on, one bad neuron charge, discharge, or one really bad day where you were sick or otherwise not sleeping and just had a bad day. But so looking for like the way that they engage with conversations and sometimes even like change who they're sitting with or what they're talking about in order to accommodate their increasing limitations and their ability to have, conversations. The other one that I would say is concerning, and maybe I'll put an asterisk on it in the tone, is repeating stories. And I think for a lot of people, that's what they do, right? They just, that is a cultural thing. It's like there's a storyteller in their family. And every time we get together, we tell the same story about how this happened, 50 years ago or whatever is going on. And so repeating the same story in and of itself is not necessarily a concerning sign, but repeating the same story without regard to kind of the social contexts, meaning I just said this story last night and I'm with the same exact people and I'm saying the same story again. It's not the repeating of the story. It's that may indicate that they forgot that this had just occurred not that long ago. And so it's not, like I said, you're not really monitoring like how many times we heard the story, because God knows everybody has somebody in their family that tells the same story over and over again. But does it make sense? Like, oh, well, last night he told the story and then those people left and a bunch of new people came and now he's telling the story again. Well, that, socially would make sense because this is a new group. I just happen to be the same one that was here yesterday. And so I wouldn't necessarily hone in on the repeated storytelling, but really the context behind it. And does it seem that that person is aware that this may have already been discussed? Now, again, it's one of those things. All of us have moments where we're telling a friend the same thing we told them last week. And you think about it just in terms of like, well, that's possible. Maybe you just forgot. But if it's within a shorter time frame and maybe more indicative that that person is unaware, again, it's not the repeating of the story. It's the unawareness that would be concerning at that time. And I really think that the bar for me, from whatever we've talked about, of any of these things rising to the level of concern, you can kind of mix and match any of these that you would like, are any of these affecting their day-to-day life? And that may be harder to know. Have they missed medications because of this? Have they had trouble making their appointments, therefore limiting their access to medical care because of this? Have they missed bills that then create other problems down the road, like their phone getting cut off or something like that? That's just really uncharacteristic for them. And this can be hard. And I'm not trying to make you like a cognitive expert in 20 minutes or something, but I just wanted to give some ideas of like what could be going on. So let's say that you do go out over these holidays and you interact with somebody that you care about and you do have some concerns about them, it's not an automatic like panic button, right? The only panic button I would say that exists is if they're actively being scammed out of, money or resources, something, investments, something like that. To me, you hit as many of the panic buttons as you can to help protect that person. But short of that, if you're just noticing something, I don't want you to lose sleep that night and think, oh my God, we've suddenly got a dementia diagnosis on our hands. There are lots of other things that can create a sense of impairment or a sense of cognitive decline or true cognitive decline that are reversible. So let me talk about a few of those things just to help you not panic if you see somebody and they're kind of not in the same shape that they were a year ago, before we get to the point of getting too worried about a dementia or something like that's happening. I'll put way at the top, right? Poor sleep or sleep apnea. So not getting good oxygenated sleep at night, not getting good, consistent, consolidated sleep at night, which of course, if you're going into a holiday rush or, you're up wrapping presents all night and for your grandkids and the next day you're trying to cook, they may not appear to be all there or operating at 100%. But in some cases, that could be easily attributed to a temporary and reversible issue, such as just, a bout of poor sleep or maybe untreated sleep apnea. So sleep apnea is when you're not getting good oxygenation at night. There's lots of different reasons for it, lots of different treatments for it. But I have seen patients that have been diagnosed with sleep apnea and treated have a life-changing improvement after that. And so I again, and you're not going to get really far into getting a dementia diagnosis until all these other things have been rolled out anyway. So if you're going to go into a process to really evaluate why somebody is having memory problems or other impairments in their life, like no doctor is just going to hand that diagnosis out for funsies. Like they have to go through and kind of think, is it any of these other things that could be causing that? Another one that can kind of mimic cognitive decline would be depression or anxiety. I'd say more on the depression side than even anxiety, but this idea of like your brain not processing and communicating and interacting as well as it could or at its optimal because of the mood disorder. And we see that, in young people as well, that depression one can kind of mimic almost like a slow cognitive decline, especially if not treated. Another one that's really important, and you may not be aware of, would be if they've been started on a new medication. This happens all the time. You ever seen those commercials and they do like the side effects at the end and they talk a million miles an hour and go through everything, right? Medications have a lot of side effects, and there's a lot of medications we use in the older adult population that can have these side effects and can mimic memory problems or slow thinking or other issues. And so they may have just been put on a medication 2 weeks ago and are having some side effects. Now, it may not be, for privacy reasons, easy for you to know that, but might be something to just consider if you're concerned about somebody, and hopefully they're in good contact with their physician or the prescriber for it, and they're getting good follow-up so that they can know if there are problems happening and take them off. Another thing that may mimic kind of this cognitive decline would be pain or especially chronic pain. So pain is a huge drain on the brain. That sounds funny. I didn't mean to rhyme. But pain is kind of like an elephant that sits on the brain because you have all these signals that are jamming up all the networks and saying, my back is hurting or my hip is hurting or whatever it is. And not leaving a whole lot of energy to process the rest of the information. And so if that person suffers from chronic pain or has a new pain that's been bothering them, that can also rob them of that kind of best version of their cognitive self that could be there. And then last but not least, again, there's a lot more than I'll just kind of stop here on other things that can mimic this cognitive decline would be a sensory loss, meaning hearing loss. They sometimes just can't hear the conversation very well. So they may exit the conversation, not because they can't follow, but because they can't hear. And I'll be honest, it's not that clear to the person that's experiencing it. From what they tell me, it's not as clear cut to them. Is it my thinking or is it my hearing? Because to them, it's almost the same thing, right? Maybe I can hear you, but I don't quite hear you, or I'm thinking I'm hearing you. It can be very confusing even to them. It's not like super clear cut of this conversation's gotten too complicated, I need to leave, or I just can't hear what's going on. And so that may impact people socially. And maybe, they're really forgetful. I asked them to do this and they didn't do it. Perhaps they have a hearing problem. Maybe they're too embarrassed to say they have a hearing problem or too embarrassed to say that they can't afford their hearing aids or the hearing aids they did buy, they lost or something like that. So hearing is a big one. And I would say hearing more prominent in this discussion than vision. And on the other hand, you have vision, right? And so if somebody is having difficulty maintaining eye contact or reading your facial expression or even tracking socially what's going on, that could also be a vision issue. Could be that they simply can't see or they're trying to kind of manage their low vision in a complex social setting, such as a celebration where there's a lot of people, a lot of things going on, et cetera. And so vision could be there also. So anyway, that was just a quick run through other things that can mimic cognitive decline that may be at play. So I'm trying to give you some reasons not to go straight from, oh my gosh, my dad is forgetful to my dad has dementia, because a lot of people kind of make that straight connection and not necessarily, right? And so anyway, I know that was really quick. I hope this is helpful. I wanted to give you kind of a cheat sheet of things that you may see, even in yourself, right? Depending on your age, and give yourself a little bit of grace about things that tend to be normal and related to aging, and then things that be a little bit more concerning. So anyway, I hope this was helpful. I wish you and your family a wonderful and safe Thanksgiving season, and I will see you again. Thank you so much. Hey everyone, it's Rebecca. Thank you so much for joining me today. I'd like to take just a moment to review the disclaimer. This podcast is for informational and occasional entertainment purposes only. Nothing discussed here is formal medical, legal, or financial advice. By listening to the podcast, we are not creating a patient-doctor relationship between you and myself or any of the guests. Really, it's just me and a possible guest or two, sometimes three, sitting around talking about difficult topics related to aging parents. If you have or suspect that you might have a medical problem or condition, you should seek advice from a licensed medical professional. If you have any questions or concerns, please read the full disclaimer in the show notes or contact me directly. Thank you again for joining us today. I can't wait to see you next week. Have a good day.